You're watching We've Got Your Back on ABC 27. Brought to you by Penn State Milton S. Hershey Medical Center.
Welcome back. A Dauphin County man had back pain and initially didn't think anything of it until it got worse. He was shocked when he found out what was causing the discomfort.
What kind of food do you want?
Can I get some chicken nuggets and some French fries?
Yes, may. Okay. And how many cents is that?
Memory-making moments for 35-year-old Mike Barnhart and his 4-year-old daughter, Victoria.
Is that 50 cents?
Sure.
Okay.
Yep, 50 cents.
I don't need it.
Times like this are very special to Mike. More than a year ago, Mike couldn't crouch down on the floor and play with his daughter.
You're so silly.
His back was to blame.
I was getting back pain and stuff, but I thought, okay, it's just from work, you know, little aches and pains.
But the aches and pains got worse.
I started losing feeling in my left side completely. Lost sensation in my left leg, could barely walk.
He would lose his balance, he'd stumble off the curb if we were taking a walk, or have to get a scooter at the grocery store if we were shopping.
When it got to the point where I couldn't walk, where I was basically hobbling, you know, trying to keep my balance because I couldn't feel my foot, couldn't feel my leg. It was basically to the point where I knew I had to go back in. And that's when the family doctor called it and scheduled the MRI.
A day after Thanksgiving, Mike found out the results of the MRI.
They had called and said, you have a tumor inside of your spine. It just caught me by surprise because it was first thing Friday morning. And I didn't know what to think. I thought that was it. I thought, you know, I have cancer, they're gonna have to cut me open, I'm not gonna be able to walk.
He told me that they found a tumor in his spine, and I honestly think he held it together better than I did. Because here I'm thinking, I'm gonna lose my husband, and all we could think about at that point was he had cancer.
Some terrifying moments for Mike and Christine.
This is the MRI of his lower back, and at the upper part of his lower back, this white segment here is a tumor in the spinal canal. And it's a pretty good sized tumor. It's about 3.5 inches from top to bottom and about 3/4 of an inch in diameter.
Dr. Jonas Sheehan sees tumors like this several times a year.
I don't think there's a good option for Mr. Barnhart besides having this removed. There's no other way to shrink it substantially. There's no other good way to know what it is, and we recommended surgery.
When I calmed down, I finally thought, it's gonna be done. So just let them do what they do and go from there.
Here he is going through this surgery that none of us would want to go through. And he's being my rock, you know, getting his wife through it just by reassuring me that he's okay with it.
For his operation, we removed the bone behind the spinal canal and exposed the tumor and dissected the nerves free from the surface of the tumor and then removed the tumor in its entirety.
Within months, Mike was able to make new memories with Victoria.
I feel great. I can do everything that I used to do. I'm actually able to play with my daughter now. She jumps on my back and she beats me up, puts me through the ringer. Before it was tough because, like I said, I couldn't even pick her up. And now I can pick her up, carry her through the store. All better now.
Okay, you go to your castle, I'm gonna stay here.
Mike's back to playing softball and hockey and running, and if not better than what he was before him and I met 7 years ago.
Dr. Sheehan told Mike and Christine he suspected the tumor was benign, and he was right. A happy ending to this story. And Mike sees Dr. Sheehan once a year to get an MRI scan. Back to you, Val.
Nice to see those happy endings. Thank you, Deborah. Joining us now is Dr. Timothy Reiter from the Penn State Hershey Spine Center. How common are spine tumors?
Spine tumors like that are not that common. If you took 100,000 people, less than 10 of them would have a tumor like that. If you look at tumors, cancer tumors coming from other parts of the body, they're more common, but they usually go to the bone.
Now, what is the recovery like for most spine surgeries?
Most spine surgeries, the recovery is not bad. We're doing a lot of surgeries even as same-day surgeries where the patient comes in and actually goes home the same day. Other surgeries, probably 1 to 2 days in the hospital. For our bigger surgeries, they're probably there about a week. But most surgeries are short.
Maintain with medication for pain?
Yes, yes. And the big thing after the surgery is to get their post-operative pain under control so they can get home.
Now tell us about the new rehab hospital.
So this is exciting. We have a new rehab hospital built very close to the main campus where, you know, patients who are in the hospital but need more physical therapy after they get discharged can go there. They're admitted there. It's Penn State physicians taking care of them, and they get intensive physical therapy, occupational therapy, and then they transition them to home.
And if a patient has ongoing symptoms following spine surgery, then what can be done?
Well, there's a lot of answers to that question. You know, the most important thing to remember is a lot of times when you decompress nerve roots, it takes time to heal. The nerves are going to hurt for a little bit longer. So I always tell my patient, you got to give it at least a month. But if they still have pain, sometimes you can have a recurrence of the same problem, like a recurrent disc herniation. You can have maybe a problem at the level above or below. You know, if it keeps going on, it's good to study things more. So maybe you need another x-ray, maybe you need a CAT scan, maybe you need an MRI to look at things further.
And what about with the pain? I was talking earlier, cold, hot. A lot of people always say, what should you use to alleviate some pain?
It really, when it first happens, we call it the acute phase, it's ice. You want to put ice on it. But then after about 24 hours, you probably want to go to heat because that's going to make it feel better.
And you say the recovery just seems to, they just move right along. All your patients progress well.
All my patients progress very well.
Good to hear. We'll be back in a few minutes with more questions for the doctor. Let's check in with Deborah Pinkerton, who's in our ABC 27 call center. Deborah.
Thanks, Val. We do have some more viewer questions, and Dr. Gianpietro is going to help us answer those. This next question is, I've had physical therapy and injections in my back for an L5 problem. I still have numbing and burning pain down the back of both legs and the heels of my feet and across the buttocks. Is this all due to my L5 problem?
Well, there's no question that a pinched L5 nerve can cause burning pain and numbness down your leg from the buttock to the foot. If you've already failed physical therapy and injections, you might consider anti-neuropathic pain medicines and even a spine surgery consult.
Okay, and here's another viewer question we have. I have cervical spinal stenosis, a bone spur, and arthritis in my neck. What is my best option for treatment? Would pain management work?
Well, that depends on the exact symptoms that you're having. If it's just pain in your neck and or your arm, then certainly you could try physical therapy, medications, injections, all of which can be coordinated by a pain medicine expert. If, however, you have nervous system deficits, such as weakness in your arms or legs, then you'll need to see a spine surgeon, probably for a spinal decompressive surgery.
That's what I was going to say. It would be best to see someone to properly evaluate the situation.
Absolutely.
Okay, great. Thanks so much. And we will have more viewer questions, and we'll have more of them coming up right after this break.